In this course, we're going to introduce you to the breather and how to best train patients with the device. Over the years, we've found these training methods serve as a solid foundation to help your patient integrate the breather into their daily life. First, let's go over the breather. The breather is a respiratory muscle training device that trains both inspiratory and expiratory muscles. Breathing against resistance during respiratory muscle training activates and strengthens respiratory muscles, as well as improves health and quality of life. Some benefits of the breather include increased maximal inspiratory and expiratory pressure, reduction of dyspnea as measured on the Borg scale, increased exercise tolerance, and improved posture control, reducing back pain, reduced hyperinflation, improved oxygen saturation, improved cardiac autonomy, reduced systolic and diastolic blood pressure, improved laryngeal function for speech and swallow, improved pee-cough flow, improved delivery and distribution of inhaled medication. For the full clinical protocol and additional benefits, download the materials to the right of this video if you're on our website. If not, visit thebreather.com/join and join the Breather Club, where you'll also be first to know about new treatment protocols by disease type for your patients as they are released. You'll also receive the latest research studies, have access to the Respiratory Training Target database, get a breather starting kit for your department, and have access to free support from our therapists on staff. Now, on to teaching your patient how to properly use the breather. Before you begin teaching your patient, introduce the breather to them with explanations of respiratory muscle training. Demonstrate proper use with your own breather first. Today we're going to get started on respiratory muscle training. It's similar to exercises that you may have done at the gym. So if you move your arm like this, you see I'm using these muscles. But if I add some weight, now my muscles have to work even harder, right? Okay, so this is resistance strengthening. The breather device allows us to do resistance strengthening to the muscles of respiration. So the dial has resistance settings, inhale and exhale. We're going to start at the lowest setting for both. During your first session with the patient, be sure to instruct the patient to hold the mouthpiece with their lips, not their teeth, as this may cause undue jaw pressure and inadequate lip seal. Ask the patient to breathe in and out through the mouthpiece, not their nose. Instruct to inhale deeply and forcefully for 2 to 3 seconds. Slight pause, then exhale forcefully for 2 to 3 seconds. Cue the patient to listen for strong wind sound for audio feedback, as a strong audible airflow should be heard for inhale and exhale. It's most helpful for the therapists to demonstrate with their own breather. The patient should slightly remove the breather from the mouth to swallow normally to prevent saliva buildup in the breather. Okay, it's your turn to try. Put the mouthpiece in your mouth. Okay, try not to clench it with your teeth. I don't want you to tense up your jaw. I want you to take a deep breath in through the mouthpiece, hold, and then breathe out. Did you hear the wind sound?
Yes.
Okay, so it's important to sit up when we do these exercises. Your shoulders shouldn't move up and down as you breathe. You want to make sure that you're using your diaphragm. Okay, when you're using the breather, make sure your stomach moves out when you inhale and returns back as you force air out for exhalation. This is called diaphragmatic breathing. So let's try this now with the breather. We're going to do 5 breaths in a row. 1, 2, good job. 3, 4, and your last one. Great. Okay, how do you feel?
Good.
Okay, do you feel out of breath?
No.
Some ways to assess progress include oxygen saturation assessment, VRI assessment, and phonation time assessment. Okay, let's check your oxygen then and see where it's at. Okay. Okay, your oxygen saturation is at 95%. Anything above 92% is great. Okay, I'm going to check your breath support while talking now. I want you to count out loud to 15. right? I'm going to tap my pen, and I just want you to count and keep up with my pen. So
Okay.
whenever you're ready.
1, 2, 3, 4, 5, 6, 7,
Great.
8, 9, 10, 11, 12, 13, 14, 15.
Okay, good. So you only had to stop at one time to take a breath. So that means you're level 1 on the VRI. Okay, so let's see how much air capacity you have to make voice. When you're ready, take a deep breath and say ah as long as you can until you run out of air. Whenever you're ready. Ah. Good. Okay. That was a 10-second maximum phonation time. Throughout treatment, remember, after maintaining training at baseline for approximately 1 week, assess if the patient can tolerate increase in resistances. Repeat each week or as tolerated. When resistance is increased, repetitions may decrease initially, then gradually increase again throughout the week. Document patient progress through levels of resistance, repetitions and sets, number of sessions, maximum phonation time, ventilatory response index, or using the dyspnea scale. Treatment goals depend on the underlying condition and patient status. Achievement of treatment goals can be expected after about 4 weeks of RMT. General treatment goals include reduced dyspnea, increased exercise capacity, increased maximum respiratory pressure, improved cough function and airway clearance, improved quality of life. Speech and respiratory therapy goals include improved hyolaryngeal function, reduced penetration aspiration, improved phonation time, improved intelligibility, improved speech breathing, improved pulmonary function, increased lung capacity and volume. Physical and occupational therapy goals include reduced blood pressure, reduced low back pain, improved blood flow to limbs, improved proprioceptive weighting and posture control, improved exercise performance in athletes, delayed metaboreflex, improved sleep quality and quantity. This concludes the course. Thanks for watching. We hope this course was helpful in guiding you through introducing the breather to your patients. If you would like additional training or have any feedback or questions, please feel free to reach out to us. You can email care@pnmedical.com or call 877-414-4449. We would love to hear your suggestions and provide you with more tools to help you on your voyage to find better outcomes for your patients.